Hello, this is Victor Gaxiola with TechGirl Financial, and joining me today we have a very special guest, Dr. Jason Bellak from the Oklahoma Institute of Allergy, Asthma, and Immunology. Hopefully I said that right. I always massacre it, but thanks for joining us today, Jason.
Thank you, Victor.
Now, Jason and I, just in full disclosure, have known each other for many, many years, and I really appreciate him taking the time to share his thoughts based on his position working with his patients on talking about what's on everyone's mind right now, which is the coronavirus pandemic. So thank you for joining us, Jason. Before we get started, can
Pleasure.
you tell us a little bit about yourself and your practice?
Well, currently living and practicing in the Oklahoma City area. I also have an office in Norman. My area of practice is allergy and immunology. And what that means is I care for patients with a range of diseases from environmental, drug allergies, asthma, and other chronic lung diseases. And importantly, in our discussion here, patients with immunodeficiency diseases. So those are patients that have difficulty fighting infections.
Hmm.
The immune system touches many fields of medicine, but it's important to know that my wheelhouse is really patients that have trouble fighting infections normally versus, say, a rheumatologist who cares for people that have autoimmune disease. I'm trained in internal medicine and practiced general medicine for 10 years in rural central Wisconsin before practicing allergy and immunology full time. At my practice, I also am the vice president of the practice, and in the past have been medical director of emergency departments as well. So I've been on the front lines uh, of issues in healthcare, acute issues in healthcare in the past, and have seen and been part of the disaster preparedness as well.
Hmm. Hmm. So I know a lot of things that you'll be sharing with us are obviously from your opinion, and no one should take this as medical advice. But I do know that you're working with your patients and that a lot of it has to do with allergies as we approach allergy season and such. But what are you telling your patients about the coronavirus pandemic?
Thank you for clarifying that. This is all my opinion and shouldn't substitute for the medical advice that you would get from your own personal physician.
Hmm.
Um, One of the most important things that we all need to remember is that um, the patients that do the best when they get sick, whether it's from the current coronavirus epidemic or other illnesses, are patients that are in good shape to begin with. So one of the most important things that we can all do is make sure that you're keeping up to date with your normal health, preventative health care.
Hmm.
And for my patients, for example, with asthma and allergies and immune deficiency disorders, making sure that they're being seen regularly and having updated action plans for these type of scenarios. So it's important that if we use asthma as an example, is that their baseline asthma is well controlled and they have an action plan in place if they are to get sick, what they can do to um, self-treat based on that action plan. And then if they are not getting well on the action plan, when to contact us. So that's the most important thing. So I think we've done a much better job as healthcare providers, in the most part, of keeping patients well. And then the very sick patients often need tertiary healthcare, for example, ICU beds, and in some cases, ventilator care management. And that's the current issue with the very sick patients with the COVID-19 illness. Um, Even though I'm getting I'm going a little beyond what you asked, but even though uh, we have done a great job of increasing those ICU beds, because in general, those are the patients that are getting hospitalized a lot of times. Um, there are times like this that could potentially overwhelm the healthcare system and the amount of those ICU beds. So,
Mhm.
circling back, it's important that they stay well, follow previous action plans, and that we all listen to our public health specialists, which are on the front lines of identifying the risk associated with emerging illnesses, including the COVID-19, and following the recommendations closely. I have the utmost respect for the folks at the CDC,
Mhm.
the World Health Organization, and the NIH, including Dr. Fauci, who's been about on every news channel
Yeah.
and has been on the front lines of emerging illnesses, starting with HIV in the early 80s. So um, I think it's important that we follow their recommendations, including the social distancing.
Yeah. Well, and I think that a lot of the conversations and the things that people have been sharing are, what to look for and how the COVID-19 differentiates from a flu, from a common cold, from a fever. And the thing that strikes me is that one of the key differentiators is that dry cough, that you don't have a runny nose, but you do run a fever. So it would be hard to detect initially because it does seem to emulate a lot of the typical flu symptoms or common cold symptoms. At what point should somebody get concerned and think that maybe I should seek medical advice or get tested?
That's a great question. We are in the peak of my normally busy season. Tree season, things are pollinating, so there's a lot of itching and sneezing and
Mhm.
dripping, and we're also in the peak respiratory virus season. So um, it's kind of the tail end of the normal influenza season, but it's also the busier season for your common cold viruses, including rhinovirus and something called adenovirus. Um, so it can get tricky in your typical season when we're trying to differentiate, is it allergies or cold? Certainly fever. Even though we call allergies hay fever, there's no fever.
Mhm.
Temperature increase typically involved. So and fever for just the most strict definition is greater than 100.4 degrees Fahrenheit. And I'll say, in general, adults don't get febrile illnesses very much. It's much more common for kids. So an adult with a febrile illness means something's going on. And this time of year, I would still think, even though the COVID-19 illness is the current pandemic, it's still more common to have a common cold and influenza than it is COVID-19. So fever would be the main thing. Now, right, a dry cough makes me think more of a viral illness or somebody that may be having an asthma or COPD exacerbation. Um, so the combination of fever, cough, and shortness of breath. Anytime you're short of breath, that's going to be concerning.
Mhm.
So the first thing that people need to do if they have those symptoms is to contact their medical professional. And like a lot of practices, the Oklahoma Institute of Allergy, Asthma and Immunology has a telehealth a program that we've initiated for sick patients or other patients that need healthcare visits that maybe can't or shouldn't come into the office. Um, uh, Also, as a resource, that the CDC has listed the 24/7 hotline numbers for the Department of Health in every state, and that number, if you contact a number, they'll give you directions on necessary testing if it's appropriate, and give you information where and how to do that. I know many healthcare systems have started doing COVID-19 testing um, using commercial labs, and that's been a big relief to everybody because we can do more testing. But in general, when you have this illness or any of the illnesses that are currently going around, the influenza, um, common cold, staying at home is important, and doing general supportive symptomatic care. So rest, increased fluids, acetaminophen for fevers and aches and headaches. There's some controversy about nonsteroidal anti-inflammatory use, ibuprofen, naproxen, things like that, and the potential worsening of the illness. And we just don't know that yet. There's no good definite data. But I'm advising my patients if they don't have liver disease or some other reason not to take acetaminophen or Tylenol to take that instead. Hopefully that answered your
No,
question.
no, good. Absolutely. No, all good things to consider. I mean, I think a big part of it and a lot of the concern from the healthcare community is that not wanting to overwhelm the system, which is one of the main reasons why isolation, social distancing is really important. And here in the state of California, specifically in Northern California, in the 7 counties around the Bay Area, we have been placed on a shelter in place mode, which is to say that we are encouraged to stay home, to not go out unless it's absolutely essential, to go to the bank, grocery store, or fill your car up with gasoline, but to try to minimize the amount of gathering. What would you say to someone that says that we're overreacting?
Well, we all have a social responsibility for our neighbors, our family members, and particularly our older patients or family members with especially any comorbid diseases like kidney disease or heart disease, etc. The thought of this just a month ago or 2 months ago would have been outrageous to anybody. I think this is always something that uh, public health officials have had as an idea, but what was called draconian, or what I've heard has been called draconian in China, has really suppressed and mitigated the spread of COVID-19 disease. I think the most recent I heard was one new case in Wuhan yesterday, and that's unbelievable. So there's this whole idea of that everybody's heard of flattening the curve, which not only hopefully decreases the amount of disease, but how quickly or how high that peak gets. So we spread out the cases and decrease the impact that it has on the healthcare system and the ability to care for patients. So there are patients, or there are folks that don't show many signs of the illness. They tend to be younger, healthier. And again, going back to what I initially said, I think we would all do better fighting any illness. The healthier we start off when we're fighting something. And there's this thought that sometimes, especially in younger folks, that they're indestructible and it won't bother them. But I think, and I saw this on a news program today of how important it is for our most vocal millennial patients and friends and children, that they really use the power of their presence and social media outreach to be supportive of complying with these difficult recommendations, but I think they're absolutely necessary. And the shelter in place is more prohibitive than other places in the country, but because of your disease activity, I think you're ahead of the curve there,
Hmm.
and that's more likely to happen in additional communities rather than not in the next several days.
Yeah. Yeah, I mean, and as we were discussing before the recording, I mean, for one thing, I think what has provided some comfort, and I'm always amazed by the resolve, of individuals, especially after times, and we've lived through 911, we've lived through the financial crisis, we've lived through, you and I, the Los Angeles riots when we went to UCLA.
Yes,
We get
earthquakes.
witnesses, and the earthquakes, right?
Well,
So
I think interestingly, I think we are as prepared in certain ways for something like this to happen than ever before.
Mhm.
Just the fact that we can have this conversation from several thousand miles away, and you're sheltering in place, but you shouldn't be socially isolated.
Mhm.
We have the ability to pick up phones and call and video conference and do kind of the business as usual more than I think we give ourselves credit for. So I think that's important that we continue to do that and continue to have um, uh, social and professional contacts that and use the technology that we have, which
Mhm.
is such a great resource.
Oh, I agree, and really for me, and I think that this is the feeling I'm getting from friends and family in this area is that we're all going through this together, and at least having a direction of shelter in place is providing a prescription that whether you have the disease or not, or if you're suffering from it, everybody knows what they need to do and how they can be responsible about it. Um,
Absolutely, and I think the president just today, the 15-day plan that's available on the .gov website as well as the Corona specific coronavirus website on the CDC, and they're all very simple, practical, common sense things that we all need to do to get through this quicker and more safely.
mhm. Well, if nothing else, it's introduced good habits. We're all washing our hands more.
Yeah.
We're being more mindful of our neighbors. I certainly will try very hard in the future never to run short of toilet paper.
Yeah.
Don't know where that came from. But my big question here is, Jason, in your opinion, when will we know that it's over or that we're at the tail end of this?
Yeah, that's a fantastic question, and it's rapidly developing. They're doing very sophisticated modeling based on previous outbreaks, including the previous SARS outbreak. So, what's important to know, the terminology kind of gets muddled, but SARS-CoV-2 is the virus.
Mhm.
COVID-19 is the disease from the virus. So the analogy is HIV and AIDS. So
Mhm.
HIV is the virus, and AIDS is the disease. Um, so if we look at the previous SARS outbreak, that lasted really until July. So I think that's where the most recent government announcements have come from. A typical virus season that I spoke of earlier that we typically see this time of year is over by the end of May, typically. So you have your flu season, which really typically peaks December through February, and then you have some common cold viruses, etc. And that generally ends by end of April, May, and it coincides with warmer weather. Now, there's theories of why that may happen, including colder, drier air may increase the ability for droplets to spread and things like that. But um, I think we it's important to know that we've made these recommendations, including the shelter in place, and that people don't get worried when the numbers are still going up. because it's lagging behind the recommendations. And of course, there are excuse me, some times where patients are asymptomatic before they're diagnosed. So there's going to be some worse data coming out before it improves, and knowing that that's going to happen, and that's typical and to be expected. And so once we start to see that peak, and we're not exactly sure what that's going to be yet, and those numbers go down after we've instituted some of these more strict social guidelines, then we'll know things are getting better. And knowing that once people are getting better, there's another few days of social distancing where they still may have viral shedding, and they may need to stay at home. But it's also important to know that 80+% of people that get the SARS-CoV-2 virus recover without any significant issues. And it still remains a mystery, but thankfully our youngest ones, including infants, and we're not exactly sure about pregnant females, but they're always considered high risk. There really hasn't been a significant disease burden in those folks. What we don't know is if they're vectors or carriers and transmitters. So that's why it's important that schools are closed. And you and I both have daughters who are seniors in high school, and it's a difficult time. And even my teenage daughter, I think, is coming around and understanding her social responsibility, that she understands that we're doing this for a reason. And the sooner we all do what is requested of us and follow our social responsibility, the sooner this will end.
Yeah, and it's one of these situations where it's going to take all of us, I think, in order to resolve this and start seeing the light at the end of the tunnel. So Jason, I know that you're very active, unlike many other doctors who are not, but you're very active on social media. You're constantly or very regularly on the media being interviewed. And so we really appreciate you taking the time to share your thoughts with us. We'd love to get you back on the program, maybe in as these things progress. But before I let you go, if people wanted to get in touch with you, your practice, or understand, some of the information that you're sharing, what would be some of their best resources for that?
Well, I'll throw in a plug for my national organization. So the American Academy of Allergy, Asthma, and Immunology, and the American College of Allergy, Asthma, Immunology, both have find an allergist immunologist on their website. So if you need a local a specialist, that's the first place to go. And I'm also on there. You could also find me on LinkedIn and on Twitter, and direct message me there. Those would probably be the easiest ways to get a hold of me. My company website is OKAllergy.com. OK for Oklahoma. We're great allergists, but we're in Oklahoma.
Yeah, you are.
So you can find us there. And I wish everybody well, and we will all get through this.
Yes, we will. And this is coming straight from the man who coined the ragweed tsunami.
Ragweed tsunami.
Yeah, that's right.
In August.
In August.
We get through that.
We're ready for that.
Yeah.
Well, Jason, thank you so much. All the best to Jen, Izzy, and the boys. Please send them our love, and hopefully.
Thank you, and the same to your family. And Kim is incognito. She's missing in action. But
she's probably taking a call right now. So she's yeah.
Good. All right. See you, bud.
Thank you.